Next talk on approach to a patient without any investigations. For this, I would like to invite Dr. Prasad Biware, sir. He's BMS, MD, MBA Healthcare. He's a CEO of Eurocool Healthcare, Eurocool Kulkarni Hospital, Pune. As CEO, sir exactly knows the complexities of patient diagnosis and treatment. Welcome you, sir. Dr. Abhay Khode, sir. He's a MD Medicine, DNB Cardiology, FSCI Interventional Cardiologist. He's the Director of Cardiovision Heart Specialty Clinic, Baner. Welcome, sir. And also he's the Chief Cardiologist at Chelaram Multi-Speciality Hospital.
So, our next speaker is well-known Dr. Prasad Biware. He is a MBBS MD Medicine, Head of the Department of Internal Medicine at Manipal Hospital, Baner. His next topic is approach to the patient without any investigations. Before introducing the speaker, I like to express my gratitude towards the scientific committee, especially Dr. Keskar and Dr. Umarji sir for organizing such a great event and such a good academic fest. As we know, if our brain knows, then only our eyes can identify the thing. Like that, the clinical examinations is such a great thing that for the diagnosis of the patient, we require a good clinical examination, and then only we can correlate with the investigation what we are advised, and we can come to the conclusion. On this basis, the good clinical examination, how it is important, the Dr. Prasad Biware is going to tell us, and he will take you in next 30 minutes about that. Dr. Prasad Biware, we know he is a celebrity physician and we all know about him, not required much introduction. He is a course director of the Manipal Clinical Excellence Program, editor of the journal MAPKIO, Shatayushi Foundation, and apart from that, as we know, he is a professional lyricist in Marathi and Hindu movies. So, over to Dr. Prasad Biware.
Thank you, Dr. Abhay. Good afternoon, BMAcon. Good afternoon. This sounds well, but I request all of you की मला टॉपिकच असा दिला की ज्याच्यावर एक 20 लेक्चर्सची सिरीज होईल आणि मला तो 20 मिनिटात कंप्लीट करायचा आहे. तो थँक्यू डॉक्टर पद्मनाभ फॉर टेस्टिंग मी. And I request all the delegates who are on the stalls that kindly have your seats. कारण मला याच्यामध्ये अगदी 2-3 गोष्टी तुम्हाला ऐकवायच्यात सगळ्यांना, and for that I will require a pin drop silence. आणि मी डॉक्टर प्रणव यांना पण त्यांचे आभार मानतो आधीच की त्या सगळ्यामध्ये मला त्यांची हेल्प लागणार आहे. To start with, approach to patient without any investigation. When we are in our OPD or IPD rounds and we ask our students or the medical assistants or the residents that if a patient of fever come to you, what will you do? He says CBC. When we ask that when a patient of abdominal pain comes to you, what will you do? And he says sonography. And I'm afraid, where is that approach to a patient without any investigation? Is there really any? And yes, Dr. Abhay, you told and you tapped the same, that yes, there is and there should be an approach to any patient without any investigation, which you can have the differential diagnosis right from looking at the patient. And my disclaimers are, every patient is different. The rule is that there are no rules. I am not against any pathologist. Ritu, I am not against any radiologist. I am not going to teach you anything, and this is not a code of conduct. So let us start. See this image that somebody is weighing on a weighing machine. But no, it is not a weighing machine. It is a wall clock on which a mad guy is standing. And the same way, when a patient comes to us, from the first moment you set eyes on the patient, it takes experience and practice to pick up on all of the possible clues. Note many of these features subconsciously, but you must work to make yourself consciously aware of them. या दोन्ही इमेजेसमध्ये तुम्हाला काही कोरिलेवन्स दिसतोय का? इज देअर एनी? इज देअर एनी? दिस इज जस्ट इन्व्हर्टेड इमेज. सो तुमचा अप्रोच थोडा जरी बदलला, तुम्ही त्याला पुढून बघताय, मागून बघताय, तुम्ही त्याला कसे बघताय, हाऊ युअर अँगल इज, हाऊ युअर अप्रोच इज डेफिनेटली गोइंग टू चेंज द पिक्चर एंटायरली. अँड दॅट्स वाय These are 3 guidelines, these are the 3 ways you should proceed with your approach, and these are simply history, presentation, examination, and of course in examination, general and systemic examination. So let us start with history. It is so simple. In my disclaimer, I told you that I am not going to teach you anything, but I am going to remind you plenty of the things that we are learning from our graduates. In the history, demographic details are most important. You have to look after and you have to know that what is the name, age, sex, religion, occupation and address of the patient. Patient कुठे राहतो, कुठल्या भागात राहतो, किती वयाचा आहे, मेल आहे की फिमेल आहे, याच्यावर पण तुमचं डिफरन्शियल डायग्नोसिस सुरू व्हायला सुरुवात असते. Then the history, in that history, the past history, is there any comorbidities like diabetes, hypertension, asthma, thyroid, epilepsy or any previous malignancies? Is there any similar illness in the past, hospital admission, procedures, operations and any recent history of traveling? All this comes under past history. Then the family history, which includes not only of the spouse and the children, but about the parents, brothers, sisters, maternal, paternal, uncles, nephews, similar illnesses in all the families, comorbidities, and is there any death? It concludes the family history. Then going for the personal history, it will include appetite, diet, addiction, lifestyle, marital status, high-risk behavior. And be very sure that all these things are very important while you are going for any differential diagnosis or you are approaching the patient. Then the treatment history is all the regular medications which Dr. Suhas had told. There are sometimes 34 medications given by some honorable nephrologist or the consultant physicians, but you have to go through all that. Then any allergies and recent medications, and to be very specific, in the pediatric age group you have to go for the immunization history and the menstrual and obstetric history in the female patients. So this is history. And to proceed with what is the presentation. In our medical language, we usually tell it that HOPI. That is the history of present illness. Just apply the cold spa for all your complaints and symptoms presented by the patient. What is this cold spa? C for character, onset, location, duration, severity, pattern, and associated factors. त्याला विचारा की तुझं काय होतंय काय? What is the description of his sign or symptom? When did it begin? Where is it? Does it radiate? Does it occur anywhere else? How long does it last? Does it recur? How bad is it? How much does it bother you? What makes it better or worse? What other symptoms occur with it? How does it affect you? This is cold spa. Apply to each and every complaint and the symptom of the patient and you will get the history of present illness, that is the presentation. And now leading to the examination part. First of all, you have to go for the general examination and the vitals. In the general examination, the simple logic is that go from face to toe. वरपासून खालपर्यंत सुरू करा. त्याला फक्त बघायचं आहे आणि त्याला असेस करायचं आहे. Face you can have the what is the ill look, is the patient is ill looking or the moderate or the is good looking, any puffiness over the face. Then eyes you can have the pillar, icterus. Then tongue, is it coated, is it dry, is it cyanosed? Then neck you can have the jugular venous pulse, jugular venous pressure. You can also have some lymph nodes. Going for the nails, is there any clubbing, is there any cyanosis? For the legs, is there any swelling over the legs? Skin, how is the tone of the skin? Is it pale looking? Is it shrunken? And the height and weight. फक्त वरपासून खालपर्यंत तुम्ही त्याला बघायला सुरू केली की तुम्ही या सगळ्या गोष्टी फ्यू सेकंड्समध्ये सगळ्या कलेक्ट करू शकता. दिस इज इम्पॉर्टंट इन जनरल एक्झामिनेशन. अँड अगेन वी सेड दॅट देर इज TPR-BP, that is temperature, pulse and blood pressure. It is having a reference range. We all know there are never normal ranges. There are always biological reference range which has been mentioned and we all of know. And now proceeding the most important and very interesting part of my today's presentation, that is systemic examination. And we do the systemic examination system-wise in the 4 systems. It is CVS, RS, abdomen and CNS. Okay? प्रत्येक सिस्टममध्ये कुठली गोष्ट इम्पॉर्टंट आहे, सगळ्यात जास्त इम्पॉर्टंट आहे, तीच मी तुम्हाला 2 मिनिटात सांगणार आहे. काही ऐकवणार पण आहे, काही दाखवणार पण आहे. काइंडली कन्सिडर. To start with CVS. First of all, for going for the systemic examination, there is a rule of LFTL, that is look, feel, tap and listen. Of course, inspection, palpation, percussion and auscultation. To start with CVS. In CVS, the most important is auscultation. But still, every examination and every parameter of the examination is having its own role. But considering the four areas, we have to go for the fifth intercostal space, mid-clavicular line is mitral area, or we can call it that apex area. Then the second intercostal space and left sternal edge is pulmonary area. Second intercostal space, right sternal edge is aortic area. And again the fifth or fourth intercostal space on the lateral edge on the right side, it is tricuspid area. There are four areas, and on these four areas, you have to go for the CVS examination. And the most important, we put our stetho, and we have some collection, clinical examination from the patient on the CVS ground. What is it? आयुष्यभर आपण मरमर केली पण कधी आपल्याला मरमर नाही कळले, अशी प्रत्येकाची अवस्था असते. म्हणजे अभय तुमची नसते, डॉक्टर अभिजित पण आत्ताच आलाय. पण व्हॉट आर दिस मर्मर्स? तो आय मेक इट व्हेरी सिम्पल. मला माझ्या एका टीचरनं शिकवलं होतं टेबलवर वाजून की S1 S2 काय असतं, आणि ऑडिबल नसलेले पण असले A2 P2 काय असतात, आणि मर्मर काय असतं, हे दोन बोटांनी टेबलवर वाजून आणि एका पेननं सरकून मला शिकवलं होतं. तो एक व्हिडिओ मला सापडला आहे. मला फक्त पिनड्रॉप सायलेन्स द्या, पुढचा 1.5 ते 2 मिनिटांचा व्हिडिओ आणि ऑडिओ हा तुम्ही ऐकायचा आहे. डॉक्टर प्रणव प्लीज.
Mid-diastolic murmur in mitral stenosis. Low-pitched rough rumbling murmur. Murmur begin with opening snap after S2. It increases in intensity before S1, called presystolic accentuation. Pansystolic murmur in mitral regurgitation. It starts with S1. So obscures S1. It has a blowing quality. Ejection systolic murmur in aortic stenosis. Begins after S1 and ends before S2. Diamond shaped, that is, crescendo, decrescendo, murmur. And, it's a harsh murmur. Early diastolic murmur in aortic regurgitation. Begins with A2. It's a decrescendo murmur. And a high-pitched murmur.
That's it. These are so simple that we go for the murmurs. But we get the same murmurs in the different areas also. त्यामुळे आपण स्टेथो कुठे ठेवतोय आणि आपल्याला कुठलं मर्मर ऐकू येतंय यावर पण लिजन किंवा त्याच्या ॲबनॉर्मलिटीज ह्या क्लिनिकल एक्झामिनेशन आपण करू शकतो. यू कॅन सी की पॅनसिस्टॉलिक मर्मर आपल्याला 3 ठिकाणी दिसतं. इट इज इन द मायटल रिगर्जिटेशन, इट इज इन द व्हेंट्रिक्युलर VSD, अँड इट इज ऑल्सो इन द ट्रायकस्पिड रिगर्जिटेशन. बट व्हेअर यू आर पुटिंग युअर स्टेथो, whether you are putting it in the mitral area, in the tricuspid area, or to look after the VSD. And that is more important, that this is CVS. तर आय थिंक याच्यापेक्षा वेगळं काही CVSच्या सिस्टमिक एक्झामिनेशनमध्ये माझ्याकडे ते आत्ता 20 मिनिटात सांगण्यासारखं नाही आहे. तो सो विल प्रोसीड विथ द रेस्पिरेटरी सिस्टम, दॅट इज RS. RSमध्ये पण तेच असतं. परत एकदा स्टेथो ठेवून ऐकायचं असतं. काय ऐकायचं असतं? देर आर सम नॉर्मल ब्रेथ साऊंड्स अँड देर आर सम ॲबनॉर्मल ब्रेथ साऊंड्स. 8-10 सेकंदाचे सगळे साऊंड्स मी तुम्हाला ऐकवतोय. प्लीज आय वॉन्ट अ पिन ड्रॉप सायलेन्स अगेन, अँड डॉक्टर प्रणव यू आर हेल्प टू. थँक्यू. Before going for that, the respiratory system, you have to go for the 2 lungs, that is left and right lung. And right lung is having 3 lobes and left lung is having 2 lobes. So get a back. These are normal respiratory sounds. आर द नॉर्मल अँड ॲबनॉर्मल रेस्पिरेटरी साऊंड्स. आणि मला वाटतं यापेक्षा कमी वेळात यापेक्षा जास्त ऐकण्यासारखं काही नसतं. तो काइंडली कन्सिडर ऑल दीज रेस्पिरेटरी सिस्टम एक्झामिनेशन्स. नेक्स्ट स्लाइड प्लीज. प्रणव, नेक्स्ट स्लाइड प्लीज. या रेस्पिरेटरी सिस्टीम आय वॉन्ट टू ॲड ऑन की रेस्पिरेटरी सिस्टीममध्ये पण तुम्ही जे सगळे ब्रेथ साऊंड्स ऐकता ते एंड इन्स्पिरेटरी आहेत की एंड एक्सपिरेटरी आहेत, तुम्ही स्टेथो कुठे ठेवून ऐकताय, पेशंट लाईंग डाऊन आहे की पेशंट स्टँडिंग पोझिशनमध्ये आहे, यावर पण त्याची इंटरप्रिटेशन ठरत असतात. बट यू हॅव टू पुट दॅट स्टेथो, यू हॅव टू लिसन दॅट साऊंड्स अँड यू हॅव टू कम्पेअर अँड यू हॅव टू डिफरन्शिएट वेदर इट इज अ नॉर्मल ब्रेथ साऊंड और इट इज अ ॲबनॉर्मल ब्रेथ साऊंड. अँड नाऊ लिडिंग टू ॲबडॉमिनल एक्झामिनेशन, दॅट इज द थर्ड सिस्टम. ऑन ॲबडॉमिन आपण काय बघू शकतो? इन इन्स्पेक्शन, शेप अम्बिलिकस, फ्लँक्स, movements and swelling. On percussion, dullness, fluid thrill, masses. On auscultation, we can have the boil sounds, rub and bruit. And on palpation, superficially temperature, tenderness, consistency, lump. And on deep palpation, organs and signs. मी ॲबडॉमिन या सिस्टीमची पण तुम्हाला फक्त एकच स्लाइड दाखवणार आहे, विच विल क्लिअर व्हॉट यू हॅव टू एक्झामिन इन द सिस्टमिक एक्झामिनेशन ऑफ ॲबडॉमिन. दिस इज दॅट स्लाइड. These are 9 quadrant. We divide it into our abdomen. And what are these 9 quadrants? Right hypochondriac मध्ये जर तुम्हाला पेन असेल किंवा प्रेझेंटेशन असेल, there is liver, gallbladder, right kidney, small intestine. In epigastric region, it is stomach, liver, pancreas, duodenum, spleen, adrenal glands. In left hypochondriac, spleen, colon, left kidney, pancreas. In right lumbar, gallbladder, liver, right colon. In umbilical region, there is umbilicus, parts of the small intestine and duodenum. In left lumbar, there is descending colon and left kidney. In right iliac, appendix and cecum. In hypogastric region, urinary bladder, sigmoid colon, female reproductive organs, and in left iliac it is descending colon and sigmoid colon. जसं आत्ता ऐकलंय तसं हे लक्षात ठेवा. इट विल क्लिअर दॅट व्हॉट यू हॅव टू गो फॉर द ॲबडॉमिन इन सिस्टमिक एक्झामिनेशन. अँड नाव द लास्ट CNS. आय थिंक डॉक्टर प्रियंका विल बी नेक्स्ट लेक्चर बाय मी, त्यामुळे मी हे अजून थोड्यात संपवलं तरी चालणार आहे. बट इन CNS यू हॅव टू लुक फॉर द हाय मेंटल फंक्शन्स विच गिव्स द अटेन्शन, ओरिएंटेशन, मेमरी अँड स्पीच. इन क्रॅनियल नर्व्स, ऑक्युलोमेटर, ट्रॉक्युलर अँड ॲब्ड्युसेंट. याचे परत 9 क्वाड्रंट असतात. 1, 2, 3, 4, 5, 6, 7, 8 अँड 9. 9 quadrantsमध्ये cranial nerves, optic nerve as in the visual acuity and field. In trigeminal nerve, if you have a sharp shooting pain at the tap of the angle of mandible, then it is trigeminal. Facial mode, of course, there is a deviation of angle of mouth. 9th and 10th nerve, they give the gag reflex, and hypoglossal, they give the tongue deviation. Now the most important is motor examination. You look for the nutrition, tone, power, reflexes, and the coordination. It is the limb and gait coordination. And in sensory, you get the pain, touch, temperature, and joint position. But now going for this power and reflexes. Again, a last video from my presentation. This power which will give, if there is no contraction, power is 0. If the flicker and trace, power is 1. Active movement, power is 2. Active movement against gravity, power is 3. Active movement against gravity, power is 4. And if normal power, it is power 5. Then what are the reflexes? Just look for the 30 seconds video, last video from my presentation. दॅट्स इट. आणि CNS एक्झामिनेशन करून पण तुम्हाला ॲटलिस्ट एवढं जरी ठरवता आलं की हे ब्रेन आणि अँटेरियर हॉर्न सेलच्या वरचं आहे का अँटेरियर हॉर्न सेलच्या खालचं आहे, इज इट अप्पर मोटर न्यूरॉन और लोअर मोटर न्यूरॉन, तरी सफिशियंट आहे. दिस इज द डिफरन्शिएशन टेबल की अप्पर मोटर न्यूरॉन असेल तर ब्रेन कॉर्टेक्स पर्यंत असतं, अँटेरियर हॉर्न सेलच्या खाली इट इज लोअर मोटर न्यूरॉन. हायर मेंटल फंक्शन्स कॅन बी ॲबनॉर्मल. इन LMN it may be, it are always normal, brain is always normal. Reflexes are exaggerated in upper neuron, reduced and absent in lower motor neuron. Spasticity and rigidity, tone is increased in upper neuron. Hypotonia is there in lower motor neuron. Atrophy wasting is less common in upper motor neuron. In lower motor neuron, atrophy wasting is more common. And plantar reflexes extensor in upper motor neuron. And it is flexor in lower motor neuron. So that's it from CNS. And now the take home message. Take home message is again, go for the